Hello everyone, and welcome to the first Talking Tuesday video series that we have created, where we review frequently asked questions and topics specific to the HealthLinks model of care. In this video, we will be reviewing the identification and invitation section of the HealthLinks model. The first frequently asked question is, what are the benefits of a coordinated care plan? Before we answer this question, it is important that we take a look at this through the lens of the client and what really matters most to them. Some of the benefits are that it is a standardized communication and collaboration tool between a client and the care providers. This is a client-driven document, which really means that they provide the meaningful input into their own care plan. Clearly identified service providers' roles and responsibilities are so important to prevent duplication of information, the services provided, and it really allows for clear communication for providers both internal to and external to an organization. The next frequently asked question is, who would benefit from a coordinated care plan? So this is the old model of care that was heavily focused on the medical model instead of the more social. So who would benefit from a coordinated care plan? Again, the old model. So those with 4 more complex chronic conditions, an individual who has visited the ED 5 times in the past 12 months, 3 of those emergency department visits had to have resulted in admissions, and those that are palliative, frail, or have mental health issues. So again, as mentioned, this is the outdated model, and now we are focusing more on the social determinants of health as a key component of the HealthLinks model of care. So asking the question again, who would benefit from a coordinated care plan? These are really clients that require coordination of multiple services. They're clients with multiple chronic conditions and complex needs, including but not necessarily limited to mental health and addictions, frail, elderly, palliative, and progressive illnesses, clients that would benefit from a team-based approach to care, clients that frequently use healthcare services, and lastly, clients impacted by the social determinants of health as previously mentioned. So this can include, but again is not limited to, food security, transportation, financial issues, social isolation, and family and community supports. Next, we'll be looking at, how do I know if a client has a coordinated care plan? So there are a few different options that you may be able to look at. So the first option is ask your client if they already have a coordinated care plan or a CCP. And if so, ask them to share it with you. With the client's consent, you want to contact the integrated care lead or the ICL to request to be part of the care team. The second option is, with the client's consent, you want to contact the LIN intake line. The number is just provided on the screen. It is 1-800-810-0000, and ask if the client is using LIN services or already has a care plan in place. If so, you want to request to be part of the care team as well, or to be connected with the care coordinator to discuss the coordinated care plan with them. The third option is, with the client's consent, you want to look in Clinical Connect if you do have access to it. If there's a globe icon appears on the dashboard, then you want to click the Home and Community Care icon on the left side of the page. Then look for the Coordinated Care Plan tab on the top of the dashboard and click on the most recent name. You will now have access to the coordinated care plan and can then contact the integrated care lead for more information regarding this client. The next question is access to the coordinated care plan in Health Partner Gateway, or HPG, at an individual or organizational level? So access to a client's coordinated care plan in Health Partner Gateway is granted at the organizational level. If consent is granted, everyone associated within the organization should be able to access the client's coordinated care plan. To find the client's coordinated care plan, you first want to search for the patient by their first and last name, their health card number, or their date of birth, and try and ensure the spelling is correct with that. Next, you want to select H&HB LIN from the organization drop-down list. And lastly, the client's coordinated care plan should appear on the page. So now I'll be going over some key takeaways from this session. So really you want to think about your clients that require multiple services or would benefit from a team-based approach to care. Those clients may have multiple chronic conditions and complex needs that also require coordination of services. So when we are thinking of clients that will likely have multiple service providers involved, you want to stop and think about whether or not they would also benefit from coordination of those services. You can also think about the clients that have visited the emergency department often, are admitted to hospital frequently, or those that use healthcare resources unnecessarily because they just don't know what else to do or where else to go. You can also identify clients that would benefit from a coordinated care plan by considering those with mental health and addictions issues, those that are frail, clients with palliative care needs, clients that may benefit from Indigenous supports, and those with progressive illnesses. We also encourage you to look at their social determinants of health, and we do know that they play such a large part in a person's health trajectory. So as mentioned before, the Coordinated Care Plan is a client-driven document that really provides a collaboration and communication. Coordinated care plans outline the goals and actions driven by the client, who are fully involved in deciding the direction of their care plan. You want to use your clinical judgment when identifying who would benefit from a coordinated care plan because really you know your clients the best and you know what their needs are. Lastly, you want to find out if a coordinated care plan is already in place before initiating a new one. Thank you very much for listening to session 1, and we hope that you continue to listen to the further sessions.